And welcome back. Acknowledging the importance of seeking assistance when it's needed, it's very crucial, whether it pertains to mental health support or accessing essential city services. Now, throughout the Bronx, social workers play a vital yet overlooked role in facilitating these connections and promoting well being across all age groups. And in honor of National Social Work Month, we're delighted to have with us today the program coordinator for the Bronx ACT team at VNS Health, Amy Amadasu, and we thank Amy for joining us.
Thank you very much. I'm happy to be here,
Yes.
Darren.
And Amy, a little bit now, because we talk about the work of being a social worker, and when we talk about, you're doing social work at VNS Health, give us a little inside scoop.
Of course, VNS Health, one thing that I love is definitely provides an integrated approach and a holistic approach to care. We, I'm part of the behavioral health of VNS Health, and we do provide various cares for families, individuals, um, adults, and children in the community. Our services are really community related, and our goal is about really providing support and meeting the clients where they're needed.
Yeah. We hear a lot when it comes to behavioral health about mental illness and mental challenges. We know it's very prevalent in society, but yet and still, so many people don't want to talk about it. Give me a little bit about, from your perspective, as to the stereotype and what's reality.
Okay. I do agree. For recent years, there have been an idea of just really educating the public in order to reduce stigma, and we have advocacy groups that we that addresses that. We actually have a peer specialist as part of the team who is someone that has a background in with a mental health condition, but is living a full life, is living a whole life, so they can provide support for other participants that have similar struggles. I do believe that I want people to hear that it's okay. We all need support, and we all need help. And there's nothing wrong with asking for help. And I do believe that when we do reach out and we reach out for help and support, it shows how resilient we are.
Mhm.
And at times we are able to see things differently when and understand and get resources that we didn't even know was there in the first place. So I do, in spite of all the stigma, I do think that awareness, having people that you know employ people that also have same similar conditions and is living a full life, like showing the examples, you know, to us, it's like it's a way to also continue to educate society, to continue to really fight the stigma,
Yeah.
and as well as really understanding that it's okay, we can all we all at some point in our lives need help and support, and understanding to get those resources is very important.
And Amy, awareness is what we're trying to bring about here today, particularly in this segment, to to give a heightened awareness. As you're looking as a social worker into the cases that you deal with, are we seeing more prevalent struggles in your clients, or what are some of the more prevalent struggles that we're seeing?
One of the things that I we've seen, I live and I work in the Bronx, and I definitely have seen firsthand, the challenges that our clients face, from employment issues to food insecurities, to substance use, to an increase, in the youth population, um, with mental health conditions. So that this is something that I am starting to see, and there are services, and our services are there to provide the care that is needed
Yeah.
and meet the clients where they are at. Yeah.
And if you have someone out there right now that's saying, listen, I might be struggling with mental illness, or somebody that says, I really am dealing with some challenges here, what advice do you give about where they can go to get more help?
Well, we do have, like I said, comprehensive care for the mental health. So going to vnshealth.org, uh, you can look through our array of services that is provided, and also we can also connect to city. A 988 is a city agency where they can connect you to needed services, from crisis services for adults and families to other services that may be needed. Our program specifically is the ACT team, where stands for um, assertive community treatment. And we work with clients that have had hospitalization within a year, at least three hospitalization, and we focus on stabilizing in the community. We are an integrated team. We work with prescribers in a team. We work with behavioral health nurses and, of course, social workers. We provide food resources. We provide um, intervention family. We have family specialists in the team where we work with families in understanding the struggles with mental health, and really provide how to support one another. We have substance use specialists in the team where we provide services where harm reduction, especially since there's been an increase. We done fentanyl and Narcan training for families and and their youths in the community as well, in order to help people to stay safe, in order to connect them to what's out there.
Yeah. Well, I got to get ready to go, but I have to ask you this question before we leave. We're celebrating National Social Work Month, and what was it that that was for you, the decision maker, to say, "Hey, I want to be a social worker"?
Well, for me, as being a social worker is an obvious choice. I really love um, in social work, just, and which is also what we do at VNS, just the person-centered care. Meeting with people and letting them know that you can have a full life. What your goals are, what your future aspiration is, and meeting you exactly where you are. I love that, and also the holistic approach, the ecosystems approach. That one problem is not viewed with just one area, but that there's an integrated way to solve a problem. So I really, or to solve a condition. So I do think that uh, social work just seems like just the obvious approach for me. And there are so many ways, from management to client-centered care to one-on-one care to providing case management and resources, wide array of opportunities. So this is why I like social work.
Well, Amy Amadasu, thank you so much for being with us. The work that you do as a social worker does not go unnoticed. We want to thank you for the work that you do, and certainly get people more connected. Thanks a lot, Amy, for being with us.
Thank you so much for your time.
All righty. Well, listen, if you want more information, go ahead and visit the website, vnshealth.org, or call 988. We encourage you, don't go anywhere. We're back with more Open coming up right after this.